Hello, everyone, and welcome to the second installment of our Ruka Estate Church Health Series for 2021. My name is Nikisha Millet, and today I will be discussing causes of diabetes mellitus. Now, just a brief plug for first presentation for those who may not have been able to tune into that presentation as yet. I really encourage you to make the time and tune in to the presentation because it has a lot of great information and it forms a good basis for what diabetes is, the prevalence of diabetes, etc. And our goal with with these presentations is basically to help persons become more informed about conditions that are relatively common, even in our church population, so that we could make better decisions. And for those who would not have the condition, we'd not just become another statistic. And for those who do, they would be able to be a more active part in the management, play a more active role, sorry, in the management of their medical condition. So, this is just a brief introduction on what diabetes mellitus is. It is a medical condition in which the body does not produce insulin, which is actually the hormone that the body uses to move glucose into cells, or produces insufficient insulin to break down glucose, leading to high blood glucose levels. Now, for us to better understand the causes of diabetes, I think it's important that we understand how insulin works. And so, my next slide just has a brief graphic of how insulin works in our body. So, initially, food is consumed, and when food is consumed, it's broken down into different substances, one of which is glucose. That would cause a rise in blood glucose, and the pancreas, which is the organ that secretes insulin through its beta cells, would detect that there's an elevation in the blood sugar levels. Now, insulin would be released then from the beta cells of the pancreas, and this basically acts sort of like a key to allow set glucose to move into cells so that they in turn can use glucose to produce what the body uses as energy. The body would then, as I said, turn the glucose into energy and use the energy for different body processes. Excess energy is stored in the muscles, in the fat, and in the liver. And when glucose levels, go down, it is the body would require more food and the process again is repeated, right? So understanding that, I think we can better understand the causes of diabetes. So the causes of diabetes actually varies by the type, and so that is how I will be presenting them, right? So the first type is type 1 diabetes, known as juvenile onset or insulin dependent diabetes. It is known as juvenile onset because it's typically seen in younger persons, usually before the age of 30, and is known as insulin dependent because insulin is the method of treatment for type 1 diabetes. Now, why is that? Basically, this is because it results, type 1 diabetes results from destruction of the insulin producing cells or the beta cells of the pancreas, which leads to insufficient insulin being available in the body. And so that is why supplementary insulin is required for the treatment, right? It is associated with other autoimmune conditions. And basically, an autoimmune condition is a condition in which the body immune system would attack its own cells and cause a range of other diseases. Um, and this is actually what we believe causes type 1 diabetes is actually the body's immune system attacking the cells of the pancreas, leading to decreased insulin production and subsequently elevated blood glucose levels, right? Type 1 diabetes of note has a minor genetic component, and like I mentioned before, it usually occurs in persons before the age of 30. So, type 2 diabetes. This is also known as non insulin dependent or adult onset diabetes. It's known as non insulin dependent diabetes because insulin isn't the only method of treatment. There are other types of medications that can be taken or can be used for persons with type 2 diabetes. And it is known as adult onset because it's typically seen in older persons. So, persons usually over the age of 40. Now, in type 2 diabetes, there's a normal production of insulin by the pancreas, but the body develops resistance to the effects of the insulin being produced by its own body, by our own body. And this results in high blood glucose levels. So, gradually, the ability of the pancreas to produce insulin also decreases. This condition is most related to poor lifestyle habits. Now, in this diagram here, I have some of the risk factors for type 2 diabetes, and these can actually be broken down into modifiable and non modifiable risk factors. So, a family history of diabetes is a risk factor for developing type 2 diabetes, but this would be a non modifiable risk factor because it is related to our genetics and that's something that we cannot change, right? Persons over the age of 45 are also at an increased risk of developing type 2 diabetes. This again is a non modifiable risk factor. It's not something we can change. We can't change how old we are, right? And the recommended screening for diabetes is actually persons over the age of 40. Ideally, they should be screened every 3 years once their previous test is normal, because again, they are at an increased risk of developing type 2 diabetes, right? Ethnicity is also another non modifiable risk factor for diabetes, and we actually see it in our own population. Diabetes is way more prevalent in persons of East Indian descent. And again, this is not something that we can change. We can't change our race, right? There's also an association with physical inactivity. And this is a modifiable risk factor because this is something that we can change. We can adjust how much activity, how much physical activity we get per day, right? And poor diet is also not mentioned here, but it's also another non-modifiable risk factor for type 2 diabetes, right? Both of these combined actually predispose persons to being overweight or obese, and this is a significant causative factor for type 2 diabetes because it causes insulin resistance. This is actually most significant out of all of the risk factors that were mentioned before, right? High blood pressure as well is another risk factor for diabetes, and that's typically because, like diabetes, well, high blood pressure and diabetes usually go hand in hand, right? They are both chronic diseases, they are both lifestyle diseases, and typically have similar risk factors. So they again would be associated with one another. High cholesterol as well is another risk factor for diabetes, and smoking, which affects every single organ system of the body, is again a risk factor for diabetes, a modifiable risk factor for diabetes, for type 2 diabetes. Now, gestational diabetes is diabetes that develops during pregnancy. Approximately 5% of women will develop this condition in their pregnancy, and it occurs because the placenta produces a hormone. The placenta is the afterbirth, by the way, sorry. That is basically the organ that provides nutrients to the growing baby, right? It produces a hormone that makes the body less responsive to insulin. This leads to insulin resistance and high blood glucose levels. And it usually occurs later in the pregnancy as the placenta grows bigger. So typically, pregnant women are tested for diabetes twice in their pregnancy as per our Ministry of Health guidelines. So they would be tested initially when when they present for their antenatal care, right? By fasting for at least 8 hours, and then taking someone would take a blood glucose sample, a fasting glucose sample. Then the pregnant woman would be required to ingest 75 grams of glucose, and their blood glucose levels would be tested 2 hours after this, right? And this is a standardized test. It's something called the oral glucose tolerance test, used to detect diabetes in pregnancy. It was very important to detect this condition in pregnancy because there are a lot of different things that can result from uncontrolled diabetes in pregnancy. If it occurs very early, babies are at risk of issues in their organ system, such as the heart, right? There's also a risk later on in the pregnancy of babies growing too big, and that causing issues with delivery, causing difficult delivery, etc. Right? So it's very, very important to screen for diabetes in pregnancy because of these associated complications, right? Of note, 50% of women who developed gestational diabetes or diabetes in pregnancy are at will develop type 2 diabetes later on in life. And so, for persons who may have had this condition in their pregnancy, it's actually advised that they really work on their modifiable risk factors like getting exercise, adjusting their diet, etc., in order to decrease their chances of developing type 2 diabetes later on in life. Some other causes of diabetes include certain genetic conditions affecting the pancreatic cells, example, something called maturity onset diabetes of the youth. This again, it doesn't really, you don't really need to know much about it. Basically, it's a genetic condition, so it's something that is hereditary. And persons who have parents with this condition, they're at a 50% chance of developing it themselves, right? And it's typically seen in younger persons. Conditions leading to the destruction of the pancreas. Again, the pancreas contains the cells that produce insulin, and so if there's destruction of the pancreas, of the cells of the pancreas, then you get decreased insulin production, which would lead to elevated blood glucose levels, which we know is diabetes, right? So conditions such as cystic fibrosis, which basically is a condition which is excess mucus production in the body, would cause scarring of the pancreatic cells, which again would lead to decreased insulin production, elevated blood glucose levels. A condition called pancreatitis, which is basically inflammation of the cells of the pancreas, again would cause decreased insulin production, leading to elevated blood glucose levels. And another condition called hemochromatosis, which is basically a big word to say infiltration of iron into different body organs, including pancreas, would again affect the cells of the pancreas, leading to decreased insulin production and increased blood glucose levels. Certain toxins as well would affect pancreatic cells, resulting in decreased insulin production. Certain drugs, such as steroids, which actually lead to insulin resistance, beta blockers, antipsychotics, medications used for HIV, etc., would also result in diabetes, can also result in diabetes, sorry, and certain endocrine disorders. And endocrine disorders are basically disorders of different hormones. Um, the and this occurs because the production of insulin is influenced by other hormones. And so if there's a increased or decreased production of any of the body's hormones, it can affect insulin production, which again, decreased insulin production leads to elevated blood glucose levels, which can lead to diabetes. And so that brings my presentation to an end. I do hope that this information was very informative. I hope that persons were able to learn a lot. And I hope that you'll continue to tune in with us for the remainder of our presentations as we explore a relatively common medical condition. And hopefully, with knowledge, you have power and you're able to make better choices for your life so that, we would be able to preserve our health. Right? Our next presentation to look forward to is the clinical presentation of diabetes mellitus. So, again, I really hope that you stay tuned with us, and I hope that these presentations are a blessing to you.